What is delirium? Changes in memory, concentration, and problem solving are typical as our brains age with the rest of our bodies. For most, changes like these are subtle and gradual. In some cases, however, such changes are abrupt and can be pretty unsettling. This might be a sign of delirium. Welcome. My name is Sreela Roy-Greene, PhD, LMHC, and licensed therapist with BetterHelp. And today we'll be talking about delirium, what it is, what causes it, and how it's commonly treated. We'll also touch on how to help someone with delirium and help yourself. Let's get started. There seem to be some myths and misunderstandings surrounding delirium. For example, some think that it's a regular part of aging when in fact it is not. So what is delirium? In short, delirium is a serious neurological condition that can happen to people at any age, although it does occur in older individuals more frequently. Delirium is marked by sudden changes in the following. Cognitive functioning. People with delirium might have a hard time understanding where they are, who they're with, or what time it is. Memory problems are common, particularly short-term memory. People with delirium might have a hard time paying attention or following conversations. Also, people with delirium might have trouble thinking cohesively or expressing themselves clearly. Behavior. People with delirium might be more alert in the morning and less so at night. They might feel very sleepy or sluggish. They may experience mood swings in which they're anxious one minute and depressed the next. People with delirium might become testy, fidgety, or irritable. Hallucinations and delusions. And finally, perhaps among the most distressing symptoms of delirium are hallucinations and delusions. Although not everyone experiences them, some may see, hear, or believe things that aren't real. Dementia versus delirium. What's the difference? Another common misunderstanding about delirium is that it's the same thing as dementia. This is also not true, although they do often share overlapping symptoms. For example, both dementia and delirium may show up as reduced concentration, memory, and spatial awareness, problems remembering where they are, what day it is, etc. The main difference between the two lie in their causes and symptom onset. Dementia is an irreversible neurodegenerative disease. Often its symptoms worsen gradually over time. On the other hand, delirium typically results from a sudden illness, medications, or other medical conditions. Unlike dementia, it's generally temporary, and with treatment, it's usually reversible. Types of delirium. There are different types of delirium with varying causes and symptoms, the most common being hyperactive delirium. People with this type of delirium might exhibit restlessness, agitation, rapid mood swings, and in some cases, hallucinations. They might pace or become combative. Hypoactive delirium. Characterized by inactivity, sluggishness, drowsiness, and reduced engagement with the environment. People with hypoactive delirium may seem withdrawn, sleepy, and less responsive to their surroundings. Mixed delirium. As you might have guessed, people with this type of delirium have both hyperactive and hypoactive symptoms. Its sudden fluctuations between restlessness and lethargy can make diagnosis and treatment more challenging. And delirium superimposed on dementia, also known as DSD. DSD occurs in people who already have dementia and is marked by sudden episodic changes in behavior and cognition. What are the main causes of delirium? Delirium is linked to problems with different brain areas responsible for things like attention, arousal, and cognitive functioning. Brain chemical imbalances may also play a role. While there is no one primary cause, things that might trigger delirium include, but aren't limited to, serious infections, head injuries, stroke, Parkinson's or Alzheimer's disease, or conditions affecting the heart, lungs, or kidneys, especially if they develop suddenly. Less obvious things can cause delirium as well. For example, intense traumatic pain, particularly if it's sudden. Some medications, interactions between medications, or drug withdrawal can also cause delirium. Also, prolonged lack of sleep can disrupt brain function and increase the risk of delirium, as can severe dehydration or malnutrition. How do doctors treat delirium? Treating delirium first involves addressing its underlying causes, such as infection or medication drug issues. To treat symptoms, physicians might prescribe antipsychotic medications for agitation and hallucinations. They might also prescribe medications to mitigate sleep disturbances. What can you do for a loved one with delirium? Families and caregivers can help at home by keeping a familiar, reassuring environment in which the individual feels safe. Clear communication can help a loved one with delirium feel calmer and more in control. Self-care for the body is key as well. If their physician approves, encourage gentle exercise and movement. Make sure they eat nutritiously, stay hydrated, and maintain a regular sleep-wake schedule. If applicable, address issues with pain and discomfort, or bladder and bowel control. How should I help my loved one during an episode of delirium? While delirium is manageable, it can be scary for everyone involved when it's unexpected. In the moment, the first reaction might be to panic. While this is understandable, it may not be the best approach. If someone is having an acute episode of delirium, first prioritize their safety and yours. Keep the environment calm and provide reassurance to the individual. Let them know they're safe and that you're there to help. If possible, you might also try minimizing noise, keeping the lighting adequate but not harsh, keeping familiar or meaningful objects nearby, communicating patiently and clearly, and avoiding disagreeing or getting into arguments. Although the symptoms can be distressing, remember that delirium episodes are usually temporary. That said, feeling overwhelmed is common. You can care for the mental health of your loved one as well as yourself by talking to a professional about your challenges. Speaking to a therapist can help you cope with stress, anxiety, and depression, as well as learn to navigate better the day-to-day challenges that come with caregiving. Support on all fronts can help you cultivate a supportive environment and provide the best care possible. Thank you so much for watching. If you felt this video was helpful, hit the like button and share it with others. Also, subscribe and enable your notifications. The BetterHelp channel offers a diverse library of videos to support your mental health and the mental health of those you care about. Take good care and see you next time.